Welcome to the Philadelphia Regional Center for Children's Environmental Health PRCCEH seminar. It is my great pleasure to introduce Dr. Ying-Q Han for today's seminar. Dr. Han is Associate Professor of Epidemiology and Biostatistics at Temple University College of Public Health. He received his PhD in Environmental and Occupational Health from Rutgers and was on faculty at Baylor College of Medicine. He studied Environmental Health Science Core Center at Baylor College of Medicine before joining the Temple University. So he is the established environmental health scientist specializing in exposure assessment and environmental epidemiology. He is director of the Human Exposure Assessment Laboratory, which aims to understand the lifetime effects of cumulative exposure on human health. He is an expert on exposure assessment of several things, including air pollution, and volatile organic pollutants, ultrafine particles, and microplastics and nanoplastics. So he conducts environmental epidemiological studies of individual factors, occupational factors, and neighborhood level factors. So he also partners with local community groups for research and translation. And today he's going to be talking about nail salon exposure.
And today I'm going to talk about the nail salon exposure assessment in New York City and New Jersey. Before I begin to my presentation, I would like to acknowledge my collaborators. Dr. Jin Young-seo is an associate professor at the Hunter College School of Nursing, and she is instrumental in these projects, and she has also conducted health survey studies as part of one of my presentation here. And also Dr. Dana Barr is a professor at the Emory University. She is the director of the Human Exposure Assessment Laboratory at Emory University. And her research team includes Dr. Panuet and Yakimavets and also D'Souza, and they are also very instrumental for the analysis of the sophisticated fatality analysis. And then Dr. Heranan is also the community engaged and community-based participatory research expert, gave us the contribution to the study design and so on. And also Masood Afshar was my former lab technicians, and actually he did a lot of the chemical analysis in this project. And finally, Dr. Ing-Yu Chao is an assistant professor at the Rutgers University, and she is also another instrument in this project. Actually, she had a long-standing relationship with the Chinese Chinese organizations in New Jersey areas. So let's see. Okay, so today, I'm going to briefly talk about 4 things. The first, I just want to give you some of the background and the research needs in this project. And then I will share the objective of our studies, and I will share some of the detailed information about how we reached out to community organizations and our recruitment strategies and the exposure assessment method. And finally, I will share some of the key findings from our studies and our next steps. So first of all, the nail salon industry in the United States hires almost 200,000 persons in 2022. And the nail salon industry is one of the fast growing industry in the United States, with the projection of the job growth about 9% from 2020 to 32. This is about 3 times higher than average national job growth projection during the same time period. And probably many of you think the nail salon industry is very popular in the Western state, such as like the Los Angeles and so on. However, the greater New York City areas ranks the highest in the United States in the number of nail salon technicians. As you see the figure on the right side of this slide, the left panel of the figure is actually showing the number of nail salons per zip code areas near the Los Angeles areas. Of course, there are a lot of the nail salons located near Los Angeles. However, when you look at the right side of this figure, this is, each dot actually represents the number of nail salons per zip code levels in the greater New York City areas. As you see here, the density of the each dots are much dense than the Los Angeles, and especially in the Manhattan areas. And also the northern part of the New Jersey, you see a lot of nail salons per zip code levels. So in overall, I mean, the greater New York City is one of the most populated nail salon areas that we need to address some of the health concerns as well. And according to the Bureau of Labor Statistics in the United States, their annual mean wage is around 31,000 in the greater New York City areas. Comparing this number to as an hourly basis, and they actually earn about less than $15 per hour. We just talked about the MPH students, the pay for the internship for this P2 center, but the P2 center actually pays $18 per hour. So comparing their hard work and their long working hours, and actually their pay is very low. Okay, so now I want to talk about some of the demographic characteristics before we jump into the study that we have conducted. And the first of all, in the United States, Asian immigrant women are major workforces. And then we estimate approximately 90% of workforce in the nail salon industry are women. And then among these, the 90% of the women, the people estimate that actually is about the 2/3 of these populations are reproductive age, ranging from 18 years old to 45 years old. And then they are predominantly first-generation immigrants and with limited English proficiency. So, for example, the recent the data available from the UCLA, and they estimate in nationwide about 80% of nail salon technicians are foreign-born, and only about 20% of the workforces were born in the United States. And because of this, and actually, do we think that they are have some limited the English proficiency because they are first-generation immigrants. And but let's just take a look at the map in the New York State. And in the New York State, the major workforces, ethnic groups are Chinese and Korean. Of course, the US-born workforce is about 15%, and followed by the Vietnamese and then Indian. So this is very distinct because, as I mentioned earlier, the most nail salon, the workforces in the Western state are Vietnamese, but in the New York State areas, the Chinese and the Korean are major workforces. However, when we focus on the New York City areas here, or the greater New York City area, which is the northern, the New Jersey side, which is close to New York City, and there are no the solid information available, but the literatures or even some nonprofit organization advocating the nail salon the technicians, they estimated maybe about over 70% of workforces are Korean and Chinese nail technicians in the greater New York City areas. So, so until now, so what do we know about the nail salon technicians' exposures? So we already know that the nail salon technicians are frequently exposed to volatile organic compounds, mostly emitted from the nail products. Those products are the benzene, toluene, ethylbenzene, and xylenes. We call it the BTEX, and they are known human carcinogens. And also because the nail salon technicians use a lot of the nail products and also nail polish removers, and those products also included many other different types of toxic chemicals, such as like the acetones or alcohols, or the other carcinogenic aldehydes, such as like formaldehydes. and also irritant compound such as like acrylase. And in this case, we call this acrylate is mostly methyl methacrylate. We call MMA, and also ethyl methacrylate. So we call EMA. So these are the well-known toxic volatile organic compounds. Frequently, those nail salon technicians are exposed. And as I mentioned earlier, the nail salon, the exposure studies have conducted in the past 2 decades. However, these studies mostly conducted in Vietnamese nail salons. So considering the popularity of the Korean Chinese nail salons in the greater New York City areas, we need to know about more information about exposure assessment and also even the health concerns in Korean and Chinese nail salons in greater New York City. And now I just want to briefly mention about some of the challenges and knowledge gaps. And I just already mentioned about the exposure assessment, the need for Korean and Chinese owned nail salons. And then also the Korean and Chinese, the nail salon technicians is a hard to reach population. So when we want to conduct occupational health and safety studies, we need to recruit these population. However, the recruitment is very, very difficult. There are several reasons. As I mentioned earlier, first, many of these workforces are the immigrant, first generation immigrant. So they have very limited English proficiency. And then that their work schedules are very busy and then unpredictable. Because unlike the office jobs, many of them are actually the working based on the customer needs and then customer the demand. So it's very difficult to create the study design based on our researchers' need. So that's very challenging. And also nail salon industry is one of the fast growing and also fastly changing industries. And because many of those VOCs that I mentioned earlier have addressed and then drawn attention to public, and the nail salon industry actually changed the legacy compound to new or the alternative organic chemicals considered less harmful, but we do not know. So the exposure to these new or alternative organic chemicals actually less examined. So the objective of our studies were two things. The first one was to identify health concerns among Korean and Chinese immigrant women working in nail salons in the greater New York City areas, mostly New York City and then northern New Jersey. And then our second aim was to characterize indoor air phthalates and the VOC exposures in the greater New York City nail salons. So you might wonder, because I'm a male investigator, and then how I conducted this study. I mean, I'm very fortunate to have so many champions in this study, especially the collaborators that I mentioned in the beginning of my presentation. So for example, like the Dr. Seo is a nurse practitioner, and then she is a perfect bilingual in the Korean and the English. And then she actually had established a relationship in many community organizations because her research was interested in especially the immigrant healthcare utilization and then improvement of health, especially the maternal health and the children's health. And she provide many free healthcare the services for immigrant, especially the Korean population, such as like providing the regular health checkup, and then also health education or consultation, and then also even the health promotion, the activities, and so on. And the same way that Dr. Chow is a perfect bilingual for the Chinese and English. And then she also did a similar type of the healthcare services for free to Chinese immigrant in mostly in the New Jersey areas. So because of these two champions, I was able to collaborate with them, and then we were able to launch our project. And among those established and then trustworthy relationship with many different community organizations in the New York and New Jersey, and then we were able to reach out to 5 the different nail salon organizations and also community the groups. And as you see here, we had partners with the 3 nail salon associations. As the first one is the Chinese Nail Salon Associations, and then Korean Nail Salon Association in New Jersey, and also another Korean American Nail Salon Association in New York City. And then also we have 2 other community organizations advocating for the immigrant workers' right and then the safeties, as you see here. So by working together with these community groups, and actually we were able to conduct this research. So although this study was not community-based participatory research, actually it's a kind of in between. So as I mentioned earlier, based on our established partnership with these nail salon organizations and the community groups, and we actually developed our study materials, such as like recruitment flyers, and then the health survey questionnaires, and also other study protocols in English, Chinese, and Korean. And then we sent these to draft to these community organization, and then we received their feedbacks and the recommendation on how we're gonna make our study materials culturally appropriate or the linguistically appropriate. And then when we revised these study materials, and we sent these recruitment flyers in English, Chinese, and Korean, and to this organization, and then ask them to distribute our recruitment flyers to nail salon owners and the workers. So in our study, we have the 2-tier approaches. So first, our approach is about the health survey. And then once we completed our health survey, and then we conducted the second stage of our study, which is the intensive exposure assessment. So I'm going to briefly talk about the health survey, which is the first phase of our study. That actually, when we distributed these recruitment flyers with our contact information, and those who were interested in participating in our research, and they contacted us. And then, because I mentioned earlier, their work schedules are unpredictable and also busy. So we actually provided 2 options following the recommendation from the community organization. Either they can answer our questionnaire survey through the online survey or the in-person survey. So those who were interested in in-person survey, so we arranged the date and time and also locations based on their preference. Sometimes we had to go to their own nail salons to administer our questionnaire, or sometimes they want us to meet at more private setting, or the informal settings, such as like maybe cafes or the library, or there maybe even some the other locations, such as like community organization, the centers, or maybe some nail salon associations. And then once we completed our study, and then we shared our result to these populations. And then once they got the result, and they were actually concerned about their own health and then their occupational exposures in their workplaces. And the several nail salon owners contacted us and asked us to conduct intensive exposure assessment in their nail salons to identify what type of the chemicals they are using, and or what kind of chemicals they are exposed, and also if that's so, and how much chemicals in their workplaces. So that's how we evolve our project to the second stage of an intensive exposure assessment. So this is kind of just a short summary of our the study method. The first phase of our health survey was conducted in 2017-18. And we were able to recruit 148 nail salon the technicians. All of them are self-identified Korean or the Chinese female nail salon technicians, aged between 18 to 45. And in the survey, we obtained demographic information, socioeconomic status, and their healthcare utilization, and their nail salon, the environmental characteristics, and also the health concerns related to nail salon, the products. And the second phase of our intensive exposure assessment was conducted at 20 nail salons, because this was not originally designed in our study, and also we didn't have enough funding to conduct more the wide levels, and then also more the nail salons. So this is kind of more pilot studies, but we were able to conduct this study in 2021. And in this study, we collected additional, the more specific salon characteristics. And then we collected the VOC samples and then phthalate using passive samplers. And then we actually developed our new analytical techniques to analyze individual VOCs as more advanced the analytical method, comparing to the existing studies. So our the method is very comprehensive, more advanced method than conventional method in existing studies. So for the intensive exposure assessment, we gathered additional information such as like salon characteristics that included location of the nail salons and daily business hours and number of customers per day, and also number of employees per each nail salons and so on. And also we obtained additional information such as like what type of the nail or the beauty services they provide. And nowadays the nail salon industry, they are actually expanding their services for other beauty services such as like the spa, facial, or the waxing. And to understand the association between some of the work practice, the factors on the levels of those chemical exposures, we also obtained several other information, such as like the type of the ventilations and the number of doors and the number of windows, and also type of the nail products they use. So we used whether we asked them whether they're gonna use the conventional nail products or organic products, or maybe they use both conventional and organic products. So some of the details about our sampling and analytical method to collect and analyze 31 individual VOCs, we use the passive batches as you see in this figure on the left side. And we use the passive batches as you see here. However, for this study, we were not able to use the personal exposure assessment, because this intensive exposure assessment was conducted in 2021 in the midst of the COVID-19 pandemic. So actually the community organizations and the nail salon owners asked us not to deploy the samplers to the person. Because of the kind of scarcity of the spread of the virus, or even the contamination during the process. So we minimize the personal contact. So instead of putting these batches for nail salon workers, we put this type of the batches on the table of the manicure tables or pedicure tables, while nail salon workers provided services for the customers. So basically, we use the fixed site, the area sampling method to characterize 31 individual VOCs. And we deployed these passive samplers for 3 work days. And then after 3 days, and we retrieved the passive batches and then analyzed the 31 individual VOCs using our own developed method, using the programmable temperature vaporizer injection method. and also to ensure the potential contamination or the background subtraction. And we also conducted additional quality assurance and quality control method that included the field blanks and matrix spikes and the duplicate analysis. For phthalate analysis, and also we used the passive sampling method. And unfortunately, the 3M OVM batches is not optimized for the collecting semi-volatile compounds such as like phthalates. So we used low cost, the silicone wristband, as you see in this figure. The silicone wristband nowadays has drawn a lot of attention in our exposure to science, because this is really relatively good to capture the semi-volatile organic compounds such as like phthalates and the other the organic chemicals. And then also it's very low cost. I mean, as you see here, the unit price of the silicone wristband is about maybe 20 cents or something like that. So in a similar the region, instead of the personal sampling, and we also hang the silicone wristband on right next to this OVM batches. So basically, we collected the fixed site sampling locations for 3 days. And of course, we did a similar QA, QCs, including these the field blanks and other things that I already mentioned. And then after a 3-day sampling period, and we analyzed the 6 phthalates analyzed by conventional GCMS using SIM mode. So now I want to share some of our research findings here. So first of all, based on our first phase of our health survey, among 148 Korean and Chinese nail salon technicians, we found that their educational attainment was relatively low compared to the same Asian immigrant population in the United States for other occupations. So for example, as you see here, about 23% of these nail salon technicians had education levels less than high school, and 39% graduated from high school. So by combining these two the groups, approximately over 60% of the nail salon technicians had a high school education or less. And in our study participant, as you see here, their English, the proficiency is either limited, about 50%, or 32%. They said they did not. Actually their English is almost zero. So we had to communicate with them either in Chinese or in Korean. So it's only less than 20% had the good English communication the tools. And for the annual household income, they reported that 1/3 of them, their annual household income is less than 20,000. And then also about maybe half of them that reported their annual household income is less than 40,000. So by combining these two, so almost 80% of our study subjects, their annual household income is less than 40,000. And it is not clear whether because of their low educational attainment or the limited English communications or the low annual household income, but we found that our popular subjects only, they had a private insurance, only the 20%. And then the rest of them did not have private insurance, and either they were supported by Medicaid or they didn't have any health insurance. So basically, our study population was very vulnerable in many ways. And we also conducted other the health surveys. So that include whether they have any health symptoms or health effects related to the nail salon work practices. And we did not find very significant effect about the respiratory symptoms or effect. They only responded that the asthma related to their work is about less than 10%. So among 148 participants, only 13 responded that they had asthma problems related to their work. And in a similar way, that they didn't experience any shortness of breath while they are working. So only the 19 participants said yes. However, we found that actually about 1/3 of the nails salon technicians mentioned that they had an irritation problem, such as like the skin irritation and then also eye irritation when they were handling nail products. And also they had allergy problems. And actually, the highest health concerns or the symptoms were the stress, as you see here. And it's about 40% of them said that they have the kind of the stress while they are working. So when we ask them what type of the stress they have, it's like kind of the categories. The first one is about the communication problems with the customers. So that's the first one. And then the second stress is related to the kind of conflict among the nail salon technicians. And then the third stress is about the uncertainty or the concerns about their unknown chemical exposures, because they know they are exposed to chemicals, but they are not sure whether those chemicals are harmful to their health or not. So those are their concerns. So, and at the end of our health survey, we also heard what their concerns or symptoms are. So it's kind of more semi-qualitative the analysis or maybe the kind of very short interview. And among various opinions or the concerns from the nail salon technicians, and here's some verbatim. And the one nail salon technician mentioned that she said, always in nail salons, we touch a lot of chemicals, breathe in powder, and smell chemical odor. All that was left was applying the top coat, but as I was opening the cap, and the solution went into my eyes. And then actually, she mentioned that she knows that she is exposed to the different types of chemicals through inhalation and dermal contact, and also even accident. But she was kind of frustrated that she does not know whether those chemical exposures are really affecting her health. And also the other verbatim that, as you see here, the nail technicians were concerned about kind of carrying home the exposures. I mean, she knows that she is exposed to this type of the chemicals, and then she is also concerned about that the family's the additional exposures when she goes home. And then also another kind of stress is related to, even though the third verbatim that she knows that she is exposed to this kind of the chemicals, and also had some of the health the effects for her children, but she couldn't stop her job because she cannot take the kind of maternal leave, because if she doesn't work, and she will not get paid, so then actually that she cannot support her family or something like that. So there are other many concerns, and by gathering all these kind of the information, and then we found that actually they are very concerned about their health and also exposure to the chemicals while they are working. So as I mentioned previously, so we were kind of fortunate to conduct kind of small pilot scale of the intensive exposure assessment at 20 nail salons in greater New York City areas. That we actually purposefully conducted our intensive exposure assessment at 10 nail salons in New Jersey areas, and then 10 nail salons in New York cities. And as you see here, the general characteristics are almost the same between New Jersey, and then New York nail salons. For example, the number of employees is almost the same. The New Jersey nail salons is about less than 7. But in the New York City nail salons, the average number of employees is about 8. And their daily open hours were almost similar. It's like 9 hours and 9 hours. And the total number of manicure and the pedicure tables in New Jersey nail salons about 14 by combining these two. And then New York nail salon is almost similar. It's like combining these two is approximately 14 as well. And also, when we conducted this study in 2021, and the installation of the ventilation systems were very similar between the New Jersey nail salons and the New York nail salons. These are the kind of more in-depth information about the ventilation system, but in a nutshell, they are very similar. However, we found the differences of the daily customers visiting to nail salons. And in general, the New Jersey nail salons had more customers per day than New York nail salons. As you see these numbers, approximately 40 customers visited the NJ nail salons. However, it's about 32 the customers visited New York nail salons. And we also gathered some of the information, whether they used the organic ingredient or not. And interestingly, we found that the nail salons in New York City, they used more organic ingredient than New Jersey nail salons. Perhaps the discrepancy may be related to customer needs and the customer demand, and also more competition in New York City compared to New Jersey. So then probably maybe the New York City nail salon they used their more organic the ingredient or the eco-friendly the products and so on. And finally, the types of services, we did not find any significant differences except the artificial nail services using the acrylics. And New York City nail salons provided more acrylic nail services than the New Jersey. So now I want to share the raw data about the individual VOCs analysis using heat maps. And as you see here, among 31 VOCs that we used the targeted analysis, and we were able to identify and detect 28 individual VOCs. And then we actually classify these 28 individual VOCs based on the potential sources, such as like the nail products, cleaning products, chlorinated products, and the general environment. And of course, we expected that the methyl methacrylate, is MMA or the EMA, these compounds are widely used in nail salons, so we expected to detect these. And also, as you see, the concentrations are relatively very high. The black color means that their concentration is very high. And then, as you see, another line over here, this is toluene. And then toluene is also very high and also detected all nail salon. This is also expected because the toluene is one of the active ingredient in many different types of the nail products. So it's always expected. However, it is kind of interesting. And also we were surprised that actually the cleaning products were frequently detected, and also the concentration was high, such as like the D-limonene and also the PNAN compounds. So this is kind of interesting finding, and also one of the new findings compared to existing studies. And also we asked the nail salon workers and the owners about their cleaning activities. And what we found that they said that they cleaned their manicure tables or the pedicure tables whenever they provided services. So basically, when they completed their service to the customer, before they having another customers, they clean tables the regular basis. So basically counting a large number of the customers visiting each nail salons, that means they clean their tables a lot of times every day. And then also we found very interesting compounds such as like tetrachloroethane. I used that one is like TECA here, and also methylene chloride. And these two compounds also relatively new findings from our studies compared to existing studies. And then we were very excited to find this compound because these two compounds had been widely used in industrial the purposes, for example, like the paint industry or the paint stripping industry. So we kind of speculate. Of course, we need more information and more data, but we think the tetrachloroethylene and the methylene chloride may be an active ingredient of the policy remover. There used to be acetone, but acetone is now phasing out, or maybe the putting the acetone to the policy remover has decreased a lot. So probably these two compounds are alternative of the acetone. Of course, the general environmental, the VOCs are also frequently detected. So, but among those 28 VOCs, for further statistical analysis, and we just want to make sure that the VOCs detected at least 50% of our samples can be analyzed for the further analysis. So then we found that 18 the VOCs actually met our criteria. And then the values below LOD was actually placed by the LOD divided by square root of 2. So then we actually made this box plus. And as you see here, the styrene concentration was the lowest concentration. And then the tetrachloroethylene, EMA, and MMA is kind of in the middle, the ranges of the concentrations. And then, as I mentioned earlier, the toluene was the most highest concentration in our study, followed by the D-limonene. And the toluene in our study is approximately, the mean value is about 10 ppb. And the level of our the toluene in our study, compared to previous studies, about maybe 100 times or even 1,000 times lower than the previous studies. Perhaps maybe because the previous studies usually conducted in about maybe 10 years ago or maybe 20 years ago. So during this time, the changes, probably the toluene has been used less frequently, or because our study was conducted during the pandemic period, so maybe the use of the nail products is relatively less than previous studies. However, as I mentioned earlier, the limonene concentration in our study is about between 5 to 10 ppb here. And the concentration of the limonene was approximately like the 3 to 5 times greater than other occupational settings. So that means this also confirmed that the verbatim from the nail salon workers and then the owners, and it means that probably they use a lot of cleaning and disinfection products in the nail salon, which is a kind of new finding in our studies. And also we compared the profiles of the groups of the VOCs between New Jersey nail salons and then New York City nail salons. And what we found is actually the New Jersey nail salons used more the skin or the eye irritant contaminant than the New York nail salons. This is actually the sum of the MMA and the EMA acrylate. And as you see here, the MMA and EMA comprised of like more than 50% of total 18 VOCs in the New Jersey nail salon. However, the New York nail salons is about less than 30%. This may be also related to the customer's characteristics and also the different state regulations. And I mean, the New York state has the prohibit the use of MMA. So in the New York the nail salons, mostly the detected compound over here is a EMA. However, in the New Jersey nail salons, we detected a lot of MMAs in these groups. And also, we did additional analysis to compare the chemical concentrations between different characteristics. And then we found that the methylene chloride concentration in New York nail salons were higher than New Jersey. However, the PNN and MMA concentration in overall, the New Jersey nail salons were greater than the New York City nail salons. And other characteristics, such as like the number of the tables and also number of customers, as we expected. I mean, the more tables that nail salon has, that means the nail salon probably have more customers. And the nail salons with more the tables more than 15, they have a higher toluene concentration than nail salons less than 15 tables. And also the more customers, actually, as I repeatedly mentioned our findings, that the limonene concentrations was higher when nail salons had a lot of customers. Okay, so for the phthalate analysis, unfortunately we had only 10 the data available so far. So we were not able to conduct additional analysis, but hopefully we get additional data, and then increased our data sets, and then do further analysis in the future. But in general, I just want to say the profiles of the phthalates are almost very similar, although we see the different concentrations across different nail salons. But the dominant phthalate is di-2, the ethyl hexyl the phthalate, which is a DEHP, is a color with a peach. And then followed by diethyl phthalate, which is denoted as the DEP, and also yellow color. And the third dominant phthalate is the isobutyl the phthalate, which is the DIBP. So these three compounds are the major ingredient of the nail products in these nail salons. So unlike the VOCs, we didn't find any significant profile differences for the phthalates. So now I'm going to talk about some limitation of our study. Of course, especially for the intensive exposure studies, because our limited funding and our sample size was small and was not representative sampling. And also, we were not able to conduct personal exposure assessment due to the COVID-19 and also the other the regions. And although we gathered some of the basic information about nail products, but we are not able to collect more in-depth the information, such as like more detailed types of the nail products and how much amount they use during our data collection period, and not only for the nail product and on the frequency of the cleaning. So this type of information was not available when we completed our study. However, we had several strengths in our study. So the intensive exposure assessment was initiated by the communities. I mean, the nail salon owners and the workers, not from investigators. So we conducted our intensive exposure assessment to respond to the concerns and anxiety of both workers and owners. And then using our the advanced analytical techniques, and we were able to identify 31 individual VOCs and the 6 phthalates. And among those, the chemicals that we analyzed, and actually we identified several unexamined hazardous compounds, such as like D-limonene related to cleaning activities, and also tetrachloroethylene and the methylene chloride and the DHP. And the most important strength of our study is actually we collaborated with the community partners. That is a key in the assessment of indoor air quality in the greater New York City. And also this approach can be also applied to other nail salons in the other states or in the globally. And I do not want to repeat our findings in the conclusion sections, just only the last bullet point that I want to talk about it. Given the large number of people hired in the nail salon industries, and even the larger number of customers visiting nail salons every day, so it is likely that the exposure is very widespread, not only for the nail salon workers and also customers as well. And mostly these populations are the female and also reproductive age. So what would be our next step? So after completion of our study, and actually the New York State implemented new regulation on the ventilation in nail salons. So after October 22, all nail salons in New York State has to have the ventilation system to adjust those the work hazard to the outside of the nail salons. And also our study also supported the new regulation, because when we analyzed our data with the nail salons, with the ventilation system and without ventilation system, we found that nail salons use the ventilation system, they could reduce toluene exposure by 50% compared to nail salons without ventilation system. So by combining these all the puzzles, and then what would be our next step? We identified that actually we found that the nail salon workers and owners, they are kind of confused, because now they have a new regulations in the New York State, especially, not the New Jersey, but they have the less knowledge about the ventilation system, and also they don't know how to use the ventilation system or when they have to use. So we want to identify the barriers of their knowledges and the attitudes and also workplace practices and even the management practices. And then by identifying these barriers, we want to develop linguistically and culturally appropriate tailored training programs to reduce exposure to chemical exposures and also the aerosols. And ultimately, we want to evaluate the effectiveness of this tailored training program to improve the knowledge of the occupational safety and health among nail salon workers. And then hopefully we disseminate our study findings to other nail salons. That could be the Vietnamese or maybe the Hispanic the nail salons and so on. So and finally, I want to thank to all study participants and nail salon owners and the community organizations and also the nail salon associations. And also this study was supported in part by the NIH's fundings. And thank you for your attention.